starts now. Health and Sexuality, a talk show that talks about education, orientation, and prevention for all ages. This show is produced by Fabiana Cavalieri and the consulting doctors Alfredo Romero and therapist Inês Cavalieri. Good morning, listeners from Radio Trianon. Sandra speaking. I'm starting our show. And now I greet Dr. Alfredo Romero. One more show starting. Dear listeners, another educational talk show. That's it. If you want to take part, 38313882 is our phone number from Monday to Friday from 9 to 7 p.m. And I start asking José's question. Fibrosis and calcifications in the penis is the same thing. In case I have a calcification, do I need to undergo a surgery? Dr. Romero. José, you are 50 years old. The first thing that can appear in your penis is called fibrosis. This fibrosis is the hardening of the soft tissues that are the elastic structures in the penis that when the blood flows in a great amount to the penis, this elastic structure stretches and gives the erection. When these structures are fibroses, you won't have a competent erection as you used to have before it appeared. Then, after some time, there will be calcium deposits in this fibrosis. And these deposit calciums that are called calcium channel blockers. I've already removed bones practically from penis from 3, 4, 5 centimeters length by 2 wide. This calcium deposited there is called calcium channel blockers, and it will deposit in fibrosis. It can be inside the soft tissue or outside, given what is called Peyronie's disease, when there is the curvature in the penis. It bends up or down, left or right. If you have this kind of problem, and if you are having difficulties in your erection, you will probably have to undergo a surgery. Basically, there are two kinds of surgery. If you are having problems in your erection, you have to remove this fibrosis and insert from your own body a piece of vein, of tissue, or it can be a synthetic tissue. In this case, it can be a biological from animals. You can use a bovine pericardium for this kind of intervention. If you are having a good erection, your surgeon can try this kind of surgery. If you are not having a good erection, then the surgery I've just described will need to have an implant from your prosthesis to allow you to have your normal sex life before you used to have this problem. Because after this implant and your normal sex life, this disease will decrease. This fibrosis will decrease. So follow your doctor's advice, talk to him about it, the possibilities, and mainly from the percentage of success in each kind of intervention. Then you follow your doctor's advice and you solve your problem. Okay? Big hug for you in São Bernardo do Campo. And after that, Arthur, 43 years old, is saying, when I cluck, I see that sometimes there is blood within. Not always, but I've been observing. At least I can't see hemorrhoids. What could it be? Dr. Ari, could you talk to him, please? So, this is an interesting question. The body is a perfect machine. If we eat healthy things, we have a better health. If we eat unhealthy things, lots of fat, spicy food full of sodium, your body will suffer. But what leaves your body is very important to check our health. For example, if your pee is dark or if it's reddish, it has to be light yellow. If it burns when you pee, the same thing when you cluck. They have to be roundish brown. If you cluck, and this is kind of little balls, there is problem in your bowels. If it's like a ribbon, if they are crushed, you have a serious disease. But if there is blood, you have to look into it. It's not normal, especially if you can see the blood. There are diseases that you have to research seriously. If you can see the blood, you don't know if it's dark red, if it's bright red. If it's dark red, it's from the upper part of your stomach. If people have bright red, it can be a bleeding in your stomach or diverticulitis. It needs to be checked. It's not normal. Whether you have hemorrhoids or not, it can be internal. But you do have to see your doctor. It's a serious problem. Dr. Alfredo. Arthur, go to your proctologist. This is the doctor that takes care of this kind of problem. The sooner the better will be for you. The treatment will solve your problem. Don't wait. There is a great variety of problems that can cause this kind of bleeding. Only a specialist, an expert with the suitable exams can tell you and can help you to solve it. Big hug in São Caetano do Sul. Every Sunday from 10 to 11 we are here at 7:14 a.m. to help you in the best possible way. Now, there is Luiz Cláudio from Pirituba. My wife is 48 and she's having crisis because kidneys in her vesicula. The doctor said that she needs a surgery, but she doesn't want to do it anyway, because 2 years ago her sister died when she was 40 years old doing the same surgery. Laser. After 2 months her father died of grief. She's really scared to die in the same way, doesn't want to undergo the surgery. What do I do? What do you have to tell him about it? This is a delicate situation. When you have this kind of stones, biliares, it depends on the size of the stone. If it's a tiny one, they can move, and the bilis that will help your digestion. It's produced in the liver, and then it's like a reservoir of this bilis. If you have this kind, if she has kind of stones, we don't know, like genetical problems that they suffer from this, but when it's tiny, it can move, it can go to this channel. And it can make the bilis and the liver to block this process. So the person can be a problem in the pancreas too. It can cause a pancreatitis. It's really serious if they are tiny. It depends on the size. That's the real problem. I've had patients with big stones and have some cramps, but he'll go on. If they are micro stones, the surgery is a solution. She'll have many cramps, she'll have pains, her stomachs, So sometimes a complication can be an emergency. She can have a serious pancreatitis because the stones can move, and then you have to do the surgery in a hurry. So the most important is the specialist. You have to go to a doctor. If it happened to your sister, it could have happened to anyone, but the surgery now is proper. There will be no cuts in this kind of modern surgery. You have to be in laser because you have a laparoscope. You don't have to cut. Then it will be faster, and the surgery is relatively simple. Some people do very well. Some people can have problems if they had problems in the stomach before, but a doctor will help you. So the important thing is the size of the stone. Go to a doctor, and if it's important, it's better to have the surgery or not. If it's huge, then you can go on if it's a big stone, but if it's not, you can't.
Pode se levar, é isso.
Rapidinho a gente volta.
We'll be right back.